Kataria, and let me welcome you all to our yet another Global CEO series interviews. Our chief guest for today is not just a Harvard product, but a member of one of the most trusted hospitals in Mumbai. Ladies and gentlemen, let me welcome Mr. Joy Chakraborty, Chief Operating Officer at PD Hinduja Hospital, Mumbai. Welcome, Mr. Joy.
Thank you, Manik.
Let me begin this conversation on a positive note. What have been some of the key CSR initiatives at Hinduja Hospital and its impact?
Hinduja Hospital is known for the CSR organization, and over the last 60 years, we are very much involved in different activities to support the society and the community. So we started giving charity and treating patients completely free of cost in our own hospital for last 60 years. But very recently, around 4-5 years back, we have decided to go out of the way to reach out to the poor and needy patients in tribal and rural areas. One of our trustees, Srimati Lalita Hinduja, she happened to show us the way through which we can reach out to the people, and keeping her vision in mind, we adopted close to 20 villages in Thane district in Jawar Taluka, where we run 9 mobile health units with dedicated around 40 staffs staying there and providing completely free medical treatment along with free medication and diagnostic services.
So no charges whatsoever?
No charges are taken from any of these patients, and it is accumulated from different group companies of the Hindujas, and it is extended as our CSR support to them. And interestingly, we have realized that there are several causes, for example, poor nutrition, hygiene, or lack of having safe water for drinking causes all these medical issues. So we are targeting those issues also to ensure that those people, they don't come back to us again and again as a patient. So if we cut or nip the problem at the bud, then automatically we can have a healthy community.
That's certainly commendable work on Hinduja's part, I must say, sir. Why do people, I believe, they still shy away from basic health insurance? So why so? Because everybody knows health is one of the most foremost things one must maintain. So why do they shy away from taking a health insurance when they know already that generally health issues are quite expensive to go with?
See, this is a matter of awareness and also a matter of attitude.
True.
Today, all of us, we buy an insurance when we buy a car. But how often we buy an insurance to maintain ourselves healthy and to take care of some sorts of eventualities. We have realized people, they feel that they are going to remain healthy. There is not going to be any emergency with them, and they feel emergencies are likely to come to their neighbors. But when they become sick, when they need this kind of support, they really realize this. Of course, one thing is the awareness, which has not happened in a big way, but for last 5 to 10 years, I must say, the insurance companies as well as the TPAs have taken a lot of measures to improve the awareness for the common people. And as a result of that, the number of health insurance subscribers are going up in our country.
That's good to know. I hope Hinduja Hospital does its bit in raising more and more awareness about health insurance. Is Hinduja into it?
Hinduja Hospital doesn't have a typical health insurance company, but in our hospital, when the patient comes and all, we tell them that you should have an insurance which can help you to have better and cost-effective care.
Wonderful. Quality healthcare is quite expensive and not easily accessible. Is this a myth or a fact? If you could elaborate a bit.
It depends upon the geography.
Okay.
So, quality healthcare is easily accessible in some parts of the country where the supply has gone much beyond the demand, where the availability of qualified manpower, nursing personnel and other inputs are easily available. But if you think about 70% of our population who are staying in rural India, for them it is really a myth, because they don't have access to those quality care because lack of infrastructural support, lack of human resource availability, which leads to an environment and a situation when they need to travel a long distance to get quality healthcare, and at the same time sometimes the kind of buying ability or the bargaining power they have, that doesn't help them to avail services in those advanced institutions.
So then, what is your view about this? That what does our immediate medical fraternity require to make quality healthcare affordable and accessible to everybody in India, not just in urban areas, but in one of the remotest corners of our country?
See, if you recall, the ingredients of healthcare deliveries of what? The infrastructure where you need to have number of beds. The second is your qualified professionals.
True.
If you have both the things available, then you can easily replicate a successful model anywhere you want to do. But for that, you need to get some incentive also.
Exactly.
Today, if I ask a doctor who pass out from a medical college after hard work of 8 years and expect them to go and work in the remotest rural area, they get scared that how do I support my family, how do I get my kids educated in a good environment.
Very true.
As a result of that, they try to avoid this kind of things. And if you look at the number of dropouts from the medical college students who doesn't want to go to the rural area for their postings, that is really shocking.
So the attrition rate is also quite high then.
Yes. As a result of that can be avoided, provided if we create some sorts of incentive structure, some sorts of infrastructure for these doctors, nurses and paramedical staff to go and work in the remotest area, and government gives incentive to the entrepreneurs who are ready to set up the healthcare facility. When I say healthcare facility, I mean state-of-the-art good facility where quality healthcare can be delivered. So if that kind of incentives and motivations are extended, I am quite sure that we'll be able to come out from this.
Precisely what I also wanted to come up to. So does this require only government intervention, or it should be more of a partnership with private firms and working in tandem with government, or just government has to step in and provide all the infrastructure?
There are different models.
Okay.
So one is, as you mentioned, private-public partnership. Now in a typical private-public partnerships, the private entity will be looking for some of the incentives from the government. That means I get a land which is economically viable for me.
So subsidies in some way.
Yes, I don't get the tax burden from the beginning. I get some sorts of subsidy in terms of other cost inputs like electricity, water and all. So if those kind of incentives are given, I can set up a private-public partnership. Even if it is not private-public partnership, there are a lot of entrepreneurs working today on the low-cost healthcare model. So if they are working on the low-cost healthcare model, if we can ensure that they get this kind of inputs at a economical level for them to start and continue their business, then definitely they are going to grow.
Of course. I sure hope our concerned government officials are watching this video. We certainly need their intervention. To conclude, you recently had a complete campus tour and also interacted with the students of Universal Business School. What are some of your views about the Universal Business School in general and the kind of students that we have here? How different it is from the rest?
First and foremost, I want to congratulate the college management for setting up this excellent infrastructure. I remember those epics where it used to be told that students have gone to their gurus and they don't stay along with the family, they stay along with the gurus in the secluded place, so they can learn. So after coming here, after looking at the environment, I felt it is really like a gurukul. Maybe they are not wearing or following the tradition of those days, they are little different and modernized version, but the environment and the infrastructure is quite good, quite helpful for them to pick up their education. And when I interacted with the students, quite enthusiastic, and I have seen they have a lot of sparks and they want to learn and they want to excel in their career. And I happen to come across the infrastructure. I have seen the way college has established the library, the wisdom center, and some of the initiatives taken. It definitely shows the vision and the expectations which is there in the mind of the management, and I'm sure they'll be taking it further forward to make it like any other world-renowned institution.
Thank you so much, sir, for your views. On this note, we come to the end of this brief conversation. On behalf of entire Universal Business School, I extend you a warm gratitude for your precious time and insights that you share with us, sir. Thank you so much.
Thank you very much.